Thyroid uptake, single or multiple quantitative measurement, S, including stimulation, suppression, or discharge, when performed. Thyroid imaging, including vascular flow, when performed. With single or multiple uptake, S, quantitative measurement, S, including stimulation, suppression, or discharge, when performed. During the thyroid uptake test, a specialized probe is placed in front of the patient's thyroid and the amount of radiotracer absorbed by the thyroid is measured as an indication of the thyroid's function. This may be performed a second time in the 24-hour period for comparative purposes. Thyroid stimulation, suppression, or discharge tests may also be performed at this time. On occasion, the radioactive iodine is given intravenously during the thyroid scan, rather than by mouth 30 minutes prior to the examination. The patient is placed supine with the head tilted backwards, extending the neck. A gamma camera is used to capture images of the thyroid from different angles. Thyroid carcinoma metastases imaging, limited area, e.g., neck and chest only. With additional studies, e.g., urinary recovery. Whole body. An imaging scan for thyroid cancer metastases is done only after ablation of normal thyroid tissue, 6 to 12 months after therapy treatment. Post-thyroidectomy patients with thyroid cancer are referred for whole body and area scanning to evaluate the thyroidectomy and demonstrate the presence and location of metastatic disease. Radioactive sodium iodide is given to the patient orally. The patient is placed supine with the neck extended and the head immobilized. Images are acquired of the neck, chest, or other clinically suspect areas with a scintillation or gamma camera that detects the radiation from the tracer in the target tissue. Report 78015 for a limited study, i.e., head and neck only. Report 78016 for additional studies, such as a urinary recovery test in which urine is collected at intervals for radioactivity counts, and Report 78018 for a whole body imaging scan. Thyroid carcinoma metastases uptake. The uptake test is a measure of thyroid function to determine how much iodine the thyroid will take up and is expressed as the percentage of the administered radioactivity present in the thyroid gland at a given time after administration. An uptake for thyroid cancer metastases is done only after ablation of normal thyroid tissue. Radioactive iodine is given to the patient orally. The neck is extended with the patient supine and the probe is placed over the gland. Since total thyroidectomy has been done to treat the cancer, and any remaining thyroid tissue would not be functioning, the radioactive iodine uptake noted to occur in the neck would be concentrated by metastatic lesions.
Parathyroid planar imaging, including subtraction, when performed. With tomographic, SPECT, single-photon emission computed tomography. With tomographic, SPECT, and concurrently acquired CT for anatomical localization. Thallium-210, which is taken up by the thyroid gland, is injected and the patient is placed supine with the neck extended and the camera centered over the neck. "60-second images are taken 5 to 20 minutes following the injection. 99 technetium is also injected and thyroid images are taken 5 to 10 minutes after injection. The images are normalized to each other and the technetium images are subtracted, distinguishing normal tissue from the parathyroid tissue. A thyroid image may be obtained 16 to 24 hours after oral administration of iodine-123 and subtracted from thallium images to yield a more optimal subtraction image due to a better thyroid to background ratio.
Imaging performed in conjunction with SPECT provides further anatomic information resulting in more precise localization. To further localize abnormal parathyroid tissue, single-photon emission computed tomography, SPECT, with or without concurrent CT imaging may be performed. SPECT provides three-dimensional imaging using gamma radiation and multiple images of the parathyroid region. The computerized tomography, CT. Adrenal imaging, cortex and/or medulla. Nuclear adrenal imaging is used to evaluate biochemical evidence of adrenal cortical functioning. After patients are injected with the radiocholesterol NP59, they return for imaging a few days later. The patient is placed in the prone position for imaging and the gamma camera is centered to detect the radioactivity in the adrenal region. Bone marrow imaging, limited area. Multiple areas. Whole body. Radiolabeled sulfur colloid is the most commonly used radiopharmaceutical for bone marrow imaging. The radiotracer is injected into the patient and images are obtained after a 2 or 3 hour delay for optimal evaluation. Plasma volume, radiopharmaceutical volume dilution technique, single sampling. Multiple samplings. The radiopharmaceutical volume dilution technique is performed to determine the patient's plasma volume by using a radiolabeled protein tracer such as iodinated serum albumin. Red cell volume determination, single sampling. Multiple samplings. The red cell volume determination test is done by using radioactive chromium to label red blood cells, RBCs. 1 or 2 vials of blood are withdrawn from the patient, the RBCs are separated out of the sample, and mixed with the radioisotope. One sample is saved to prepare the standard sample by diluting the known volume of radiolabeled RBCs with water to a known volume. Another sample is injected back into the patient's arm and after a 15-minute delay, blood is withdrawn from the opposite arm. The red cell volume is calculated using a formula that applies the dilution factor from the standard. Whole blood volume determination, including separate measurement of plasma volume and red cell volume, radiopharmaceutical volume dilution technique. The radiopharmaceutical volume dilution technique is performed to determine the patient's plasma volume and red cell volume simultaneously by using a radiolabeled protein tracer such as iodinated serum albumin and autologous radiolabeled red blood cells. Red cell survival study. Prior to the procedure, the RBC volume is measured. Blood is withdrawn from the patient, the red blood cells are separated, mixed with the radioisotope, and injected back into the patient. The initial blood sample is taken on the first day and repeated at intervals for the next 2 to 3 weeks or until half of the initial radioactive chromium-labeled RBCs are present. Whole blood samples are withdrawn and the hematocrit levels recorded. Labeled red cell sequestration, differential organ/tissue, e.g., splenic and/or hepatic. Red blood cell, RBC, sequestration is a test using chromium-51 labeled autologous red blood cells to determine if the liver or spleen is the major site of sequestration. Spleen imaging only, with or without vascular flow. Radiolabeled sulfur colloid is the most commonly used radiopharmaceutical for spleen imaging. The radiotracer is injected into the patient and images are obtained after a 15 to 20 minute delay. Platelet survival study. For the procedure, blood is withdrawn from the patient, the platelets are separated and labeled with indium-111, and re-injected intravenously. Samples are withdrawn at intervals and the platelet levels recorded until a certain level of tagged platelets are left in circulation. Lymphatics and lymph nodes imaging. The patient is placed in a supine position and radioactive antimony sulfide colloid is injected according to the lymph node to be visualized. For axillary and apical lymph nodes, for example, the injection is into the medial 2 interdigital webs of the hand and imaging is done 2 to 4 hours later. For the internal mammary lymph nodes, the injection is into the posterior rectus sheath below the rib cage and imaging is dependent upon the study. For the iliopelvic nodes, injection is into the perianal region with the patient in a knee to chest position. Liver imaging, static only. With vascular flow. Liver and spleen imaging, static only. With vascular flow. Radiolabeled sulfur colloid is the most commonly used radiopharmaceutical for diagnostic nuclear imaging of the liver. Radiolabeled heat-denatured red blood cells are used for detecting asplenia and polysplenia. The radioisotope is injected into a peripheral vein and extracted by the liver and spleen. Liver imaging, static only. With vascular flow. Liver and spleen imaging, static only. With vascular flow. Radiolabeled sulfur colloid is the most commonly used radiopharmaceutical for diagnostic nuclear imaging of the liver. Radiolabeled heat-denatured red blood cells are used for detecting asplenia and polysplenia. The radioisotope is injected into a peripheral vein and extracted by the liver and spleen. Hepatobiliary system imaging, including gallbladder when present. With pharmacologic intervention, including quantitative measurement, when preformed. Nuclear imaging is performed of the hepatobiliary ductal system, including the gallbladder if present. Special radiolabeled aminoacetic acids that are rapidly cleared by hepatocytes and excreted in the bile are injected into a peripheral vein. A scintillation or gamma camera takes planar images of the ductal system on computer screen or film by detecting the gamma radiation from the radiopharmaceutical in the body tissue as it scintillates or gives off energy in a flash of light when coming in contact with the camera's detector. An oral agent is administered that concentrates in the gallbladder after being absorbed in the intestine and excreted by the liver. Salivary gland imaging. With serial images. For salivary gland imaging, the patient is injected with a low-level radiotracer and immediately imaged with a scintillation or gamma camera that takes planar images of the salivary, or parotid, gland by detecting the gamma radiation from the radiopharmaceutical in the body tissue. Salivary gland function study. In a nuclear imaging salivary gland function study, the patient is given a radiolabeled sulfur colloid mixture under the tongue that allows the visualization of the flow of saliva from the oral cavity through to the esophagus and the stomach.